September 5th. Stacy Flowers joins us now from Direct Primary Care Associates. Stacy, good morning.
Good morning.
How are you doing?
Great. How are you?
Good. Great to see you. So I understand things going very well there at Direct Primary Care Associates.
They are. We hit a big milestone recently across our offices in Athens, Cleveland, Dalton. We've recently hit 3,000 patients. And that's something that we're really proud of. Direct primary care, the concept of that is something, even though that we've been in the community for 5 years now, is still something that you could walk up to most people on the street and they don't know what it is. And so we're still really trying to get out there and spread the word about what direct primary care, what that care model is and what we do at Direct Primary Care Associates specifically. There are other direct primary care model offices in town, and they're doing well too. And we really are thankful for the growth of everybody's business. There are plenty of patients in Cleveland and the surrounding areas to go around, and we just really want for the community to know more about that model and what that means. And what that is membership-based primary care. Most of our patients do have insurance, but that may be a high deductible plan or a plan that has a lot of copays. And there's something new as a part of the big, beautiful bill that is going to be changing in January, where HSA money can actually be used for direct primary care fees. So for those monthly membership fees. And so that's something that's going to change the way that looks even more. But so for direct primary care, our patients come in and they have no wait times. They have same and next day appointments, and they pay that monthly membership fee to have completely unlimited access to their provider. We keep those patient panels small for each of our providers so that they can provide that high level of care. And so whether you're an individual, a family, a company, each individual that comes into our office is getting that high touch, high level of care where we really are able to get to the root causes. We are not in the business of band-aiding symptoms with medicines. We want to get to the root causes and spend that time with those patients to help them really change the trajectory of their health moving forward.
We're talking with Stacy Flowers with Direct Primary Care Associates here in Cleveland. So that is a huge milestone, 3,000 patients. So what do you think are some of the reasons for that?
We have a great marketing team, that gets out into the community to spread the word about what we're doing. We provide great care in office. We have super high patient satisfaction scores. We pride ourselves in providing just the highest level of care possible to those patients. We really give them that high touch, and we're so affordable. People are paying more for their morning cup of coffee or maybe lunch a few times a week or a gym membership than an entire month of care that's available that includes labs, that includes over 1,000 generic medications. And so the value that people are getting, they'll often come in and when we finish with the visit and they just can't believe the amount of time that they got to spend with their provider. And then they'll go to check out and they'll be like, okay, well, what do I owe you? And we get to say, nothing. You've already paid for everything in your monthly membership fee. When you come into the office, there's nothing extra that you have to pay. And so that really blows people away. They're so used to paying that copay or there being some hidden cost. And the beauty of direct primary care is that there are no hidden costs. There's no surprise bill that you're going to get. Everything is completely cost transparent and upfront. So people can make those plans and budget for the health care that they plan on spending. We need to plan on having primary care. We need to plan on getting sick a couple of times a year or checking that blood work to make sure that we're staying healthy or to deal with those common chronic illnesses that come up that are the result a lot of times of our Western diet and our sedentary lifestyles and things like that. But it's hard to get to middle adulthood and not have some amount of medical issues related to just the way that we live. And so for that care that you can, not the surprise things that you don't know that are going to come up, but the care that you can plan on that you're going to need, that your family is going to need throughout the year. To be able to budget for that transparently and upfront is something that's really invaluable to families with the economic climate the way it is.
So if someone would like to reach out and get more information, what's the best way to do that?
You can check us out on our website, directprimarycareassociates.com, or people can call us at our Cleveland office at 423-650-4831.
All right. That's our friend Stacy Flowers with Direct Primary Care Associates. Great to see you.
Thanks. You too.
All righty. It is